In the US, a person dies every 34 seconds from heart disease. What if you could prevent a heart attack before it happens? The latest technology can take the guesswork out of knowing your heart health so you can be proactive. Dr. Rajiv Agarwal with the Modern Heart and Vascular Institute shares how that works and who should take advantage of it. Good morning.
Good morning, Deborah. How are you doing?
Good. So many of us rely on symptoms to tell us that something might be wrong and that we should go to the doctor. But in the case of a heart attack, as we've mentioned before, sometimes the first symptom is the actual heart attack.
That's correct. Actually, 1 out of 3 people who we definitively diagnose with heart attacks have not had symptoms. I mean, some people think that the only symptom that they'll experience is I feel like there's an elephant sitting on my chest. No, that's not the case. There's so many other symptoms that mimic a heart attack that people need to be aware about.
Yeah, other people, another misstep that we make is that we assume that the heart attacks happen to other people. For example, we think that it's only people who are obese or old or just men. It's a man's disease.
No, no, no. It's definitely not just a men's disease. Women are actually pretty much 50-50 with men having heart disease. We always encourage our women to get mammograms and all of that. And women have to remember that heart disease is the #1 cause of death for them. And it's 15 to 30 times more likely than breast cancer. So we support the mammograms and all of that. But we need all women to start thinking about heart disease primarily.
Yeah, we've moved the bar from hoping we don't have a heart attack to knowing if a heart attack could be coming. So, why wait for that to happen? We also have to, in healthcare, I think for a lot of us, need to move more toward that proactive. You can actually, with the CT scan, predict if a heart attack could be around the corner?
Yeah, the CT technology it's been around for a few years, but the more sophisticated, up-to-date scanner, like the one that you're seeing on the screen there, it's a 128 slice scanner, which means we can scan your heart literally in 1 to 2 seconds. And the information you get from there is profound. We can see if you have any calcium buildup in the arteries of your heart, which in turn means blockages, and blockages are what cause heart attacks. So to have this amazing technology that can pick up heart disease at such a early stage, especially if you've had COVID, especially if you have risk factors. I mean, I don't know why everyone wouldn't get that done.
Yeah,
Really.
and I got to tell you, for me, I was like, I went in there and my mindset was if something's wrong, I have time to fix it. Or if nothing's wrong, it gives me peace of mind. Luckily for me, you explained to me what you saw on that scan there. And you said, you're good. You're not going to have any heart issues. But you mentioned, especially if you had COVID, this is the reason why we're seeing so many younger people with some heart issues coming in.
Absolutely. Just the other day, we had a 41-year-old guy, Deborah, who came in because he really wasn't having much symptoms. He was getting a little more out of breath. And lo and behold, he had a 95% blockage in the widowmaker artery that one of our interventionalists fixed up. And had he just relied on, well, I'm going to wait until I have more symptoms, he probably wouldn't be alive today. I mean,
Yeah.
this is hitting all of us very hard at an earlier and earlier age these days.
And you're seeing it in people who have done everything proactively, good diet, they work out, they're runners and the whole bit. You've seen those folks come in and have an issue.
Absolutely. So some people think that, well, I don't smoke or I'm not diabetic, I'm not overweight. No, 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 no. Let's not fall into that trap. Heart disease does not discriminate. Yes, those people that have more risk factors are at higher risk, but even people that have no risk factors, again, especially if you've had COVID, and the other risk factor that I'll really point out would be family history. If you've had any family members, I would say below the age of 65, that have had heart disease, strokes, stents, bypass surgeries, please don't wait. Get yourself screened early because we can prevent what happened to them from happening to you.
What are the next steps if someone goes in and you say, okay, we see some significant blockage here? What would be the next step then?
Yeah, really it depends on their symptoms and possibly some test results. If they have no symptoms and let's say a stress test or PET scan is normal, then we can manage it conservatively just with medications. That may be an aspirin, cholesterol medication, and really focus on prevention from the lifestyle standpoint. But if they have a bad blockage, then nowadays it's outpatient. You come in, you get a stent, you go home. It's a very, very minor stay at the hospital.
Yeah, there are a lot of things that can happen to us that are out of our control. This is something that can be in our control with this technology. Dr. Agarwal, thank you.
Thank you, Deborah.
All right, Modern Heart and Vascular Institute has a special offer for Great Day viewers. Throughout February, you can get 2 heart scans for only $149. Bring a loved one or bring a family member or friend. Dr. Agarwal will review your scans himself. To sign up, give them a call at this number. It's 832-644-8930. Again, that's 832-644-8930, or you can book your appointment online at modernheartandvascular.com. Modern Heart is also seeing patients in 2 new locations in Tomball and in the Texas Medical Center as well, with free parking.